We're glad you're along with us today. It's important to know if you're at risk. May is National Stroke Awareness Month, and next week you can get a free stroke risk screening at Fayette Mall.
And Dr. Ben Newman is here to tell us more about that. We thank you for coming in.
It's my pleasure.
First of all, let's talk about the risk for stroke, the symptoms. What do people need to be watching out for?
Well, the first thing to talk about is how to recognize when you think you yourself or a loved one might be having a stroke. And we recommend the acronym FAST, F-A-S-T. And each of those letters has an indication of the type of thing you might look out for. So F is for face, so you have a drooping face, or is the smile sort of asymmetric? Do you notice any trouble with speech, for example? Are you having trouble getting your words out, making sense, those sorts of things? Numbness or tingling on one side of the body, weakness on one side of the body. And then obviously the T is for time, because when we're talking about stroke intervention and getting treatments for strokes, it is extremely important to get to a hospital and get medical attention just as quickly as possible.
Yeah, don't sit around and think about it for a while. You need to make sure you get to a hospital quickly. Those are the symptoms. What about the causes? Why do people get strokes?
The most common sort of risk factors that we see for strokes are high blood pressure and poorly controlled cholesterol. And then other secondary stroke risk factors are things like diabetes, and of course here in Kentucky we have a lot of people that smoke cigarettes, and obesity. So those are really the big ones that we talk about when we talk about stroke risk reduction.
So if you have those preventable risks, prevent them, get rid of them, right? Is that
easier said than done?
Sure.
I like to tell, I joke with my patients, I ask them to do hard things all the time. I say you need to quit smoking, you got to lose weight, you got to exercise, keep your diabetes under control. It's really that common sense, clean living stuff that we all know that we should be doing, but it's harder to put into practice sometimes.
Not always easy to do. You're right about that.
Right.
So what about these screenings? What will you be doing with people? Do they need to bring any records of anything, or just show up? What happens?
Just show up. We'll take care of the rest when you get there. Really what we're doing is we're trying to educate people about the signs and symptoms of stroke, what to do if you think you're having a stroke, and talking to them about what their specific risk factors might be.
You'll be set up there on the south end of the mall out in front of Dillard's, and you're just inviting folks on May 19th to stop by during those hours.
That's right. Fayette County Mall next Friday, May 19th. Stop by and we'll talk to physicians, nurse practitioners, medical professionals, and we'll talk to you about stroke, what your risk might be, and how to take better care of yourself.
Could help you save a life there. Thank you very much.
It's my pleasure. Thank you.
Appreciate it.